and welcome to another episode of Postpartum Connections. And I'm your girl, Tashia, and I'm here with my friend Ashley.
Hello.
And we have Dr. Julie Hurtado with us.
Hi.
And we are here to talk about the milestones, the plan after the birth plan. So we are accompanied by, like I said, with Dr. Hurtado. She is Colombian-born pediatric attending physician, currently working at Broward Health Medical Center in Fort Lauderdale, Florida. She's a board-certified pediatrician for over 15 years. Wow. Yes. With experience in inpatient and outpatient care. She's certified in Pediatric Hospital Medicine with extensive expertise in hospital-based pediatrics, resident and medical student education, multidisciplinary team leadership, and recognized for her commitment to quality improvement, patient safety, and academic medicine. So do you like to teach?
Yes,
Yeah,
I do. Yeah,
that's good. You're teaching our future pediatricians.
Yes.
I love it. You have to be able to take on that. What made you want to be a pediatrician?
Why?
Yeah.
Well, I mean, it is a process, but being with kids, and I usually work actually with newborns. It's just a unique opportunity to be in a hospital with patients that are actually happy to be there. So it's like a nice experience. You don't see that anywhere in the hospital, so I love it. Yeah.
Absolutely. I like the way that you put that. They're actually happy to be there because they've just gotten there, right?
Yeah.
Or like we were saying the other day, how like the babies are born angry.
Yes, right.
Not my babies. No.
Right. So in this episode, I really wanted to just dive into like the milestones. I know that we have a lot of parents that are out there that are wondering about their newborn and what to expect. And when we're looking at that postpartum time and how we're watching our children develop, what that really looks like. So can you just share with us the typical milestones that providers are looking for or that parents should be on the lookout?
Okay, so obviously every age has different expected milestones, but the most important thing that we need to always think about is that there is a normal variation. Like no one does everything in one specific moment or like in a specific a path. Okay. And there is different milestones, right? Like we talk about like motor development,
right.
Social, speech. So there is different areas that we are going to be looking for. Okay. Starting with newborns, believe it or not, obviously there is some certain things that babies should be doing. Okay.
Right.
And even though we don't get super stressed about there is, because again there is also variations depending obviously in the gestational age the baby is born. Also is different. That is like a 35 weeker versus a like 40 weeker. Okay, that obviously those babies are gonna be different, like motor wise, for instance. You're gonna look the motor area, like babies usually are like flex and have like tone. We talk about tone. That would be kind of like the motor. Babies are usually reactive to sounds. That's also very important. Okay. They don't really see, but they identify like lights and maybe shapes.
Right. But when does that vision normally like come in? Like when it turns from.
So it depends, but talking about newborn, they're not gonna be like. I mean, they can track like lights, but
Gotcha.
they're not gonna be like seen. Like we don't test. Because every time what part of the physical exam in a newborn, for instance, is to look at the red reflex, and parents think we're like checking for vision. Like there's no way, right? Like we don't check for vision at that point. We just look, make sure that the eyes are healthy and there should that they potentially can see. But it's not like we're testing for vision, okay? Where babies have like certain reflexes that are normal, right? Like the moral reflex, like the sucking, rooting, all those things are normal that babies should have. Okay.
Right.
There is some deviations, like not every baby has like a super strong, let's say, suck, okay, but doesn't necessarily mean it's abnormal, right? Like, I mean, it's just, it can be, it also depends on the moment that you examine the baby, and again, the gestational age is very important. If it is the first day versus the third day, that also makes a little difference.
A little different.
So in general, those are things, you know, a lot of parents have expressed concerns about like many things in newborns because they actually change a lot. Versus, you know, day 1 versus day 3 is completely different. Like what babies should be doing, for instance, feeds. You know, on the first day, babies feed, you know, not so often, and that's okay. Versus third day, babies should be already feeding like you know 8-9 times. You know, for instance, the sleeping is also different on day 1 versus day 3. Newborns usually at the end of the newborn period, they should be sleeping around 17 hours in a 24-hour period.
Got it.
They other things that they ask about, like weight, for instance. The parents get very concerned about the weight loss.
Yes.
Okay.
Yes.
That's not really a milestone, but it's another thing that we encounter a lot because babies normally lose weight. Okay, and that should be something that is expected even on babies that are born that are formula feed, and they usually regain their weight around 10 days of age.
Okay.
Jaundice, like the yellowish color, let's say, of the skin, which is a normal process, and most babies, a lot of them actually, is again normal, but some of them are not. So some of them need like treatment for that. So that will be something that the pediatrician needs to address to see if it requires treatment or if it's just a normal process. So that's something.
Right.
But the yellowish color is normal, and it takes weeks actually to actually resolve. So you can see babies that look a little yellow, jaundice.
For a few weeks.
Exactly.
And not necessarily needing some sort of treatment, but it takes time to resolve itself. You mentioned something about the gestational age, right? And so do a lot of parents end up showing concern that it may not necessarily be a concern because of the gestational age? Is that something that the newborn can kind of work through, as opposed to there being real, like, okay, you're gonna have to start making sure that this is done in order to catch them up, so to speak?
So babies, depending on how premature they are born, it also takes so long for them to catch up. Okay, so if it is obviously a baby that was born at 25 weeks, right, it will take him a lot longer to catch up versus a baby that is born 36 weeks. Okay. They do obviously, let's say a baby was born 36 weeks, meaning like potentially like 4 weeks before the due date. Right. So we can always explain to the parents that okay, so this baby is gonna be a lot slower, like let's say in the first 4 weeks. Okay. Kind of like to just give them a general idea. Doesn't necessarily mean most of the 36 weekers can behave like a 38 weeker. It doesn't really it's not like exactly, but if the baby is taking a little longer, then you can say, okay, remember he was 36 weeks, okay, so be patient. It's not gonna be like as as active or like as a 40 weeker, for instance, okay. So it just does make a difference. That's very important. But if they were 25 weeks, obviously it's gonna take months. And actually we do adjust that when we do the evaluation later on at 2 months, 4 months. That's something that we do take into consideration. We adjust that to the gestational age.
So there's an adjustment that occurs. So like when you guys do, so what are some of the, like what is the assessment that you do? Is it the ages and stages or the ASQ?
So every time you go to your pediatrician, there is certain things that they check, right? Like that's why it's important to go. It's not only vaccines,
right?
Because I know.
That's a whole other
topic. But going to the pediatrician is not only vaccines. Okay, so there is a lot of things going on. Okay, and that includes obviously physical examination, like the weight, the length, when it's babies versus height or whatever. Right. Vitals are very important. Okay, depending on the age, sometimes even blood pressure and stuff like that. But also the development. Okay? Right. So development is something very important, and depending, so like let's say at 2 months, 4 months, 6 months, those are things that we are okay. So he's supposed to be doing this and that. So
Gotcha.
obviously, if you have a 2-month-old who was born, usually 2-month-old born at 25 weeks probably is going to still be in the NICU.
In the NICU, yeah.
But let's say a 32-weeker, okay, at 2 months old, he may be a lot smaller,
Right.
and little let's call it delay because he was born so preemie, right? Like comparing to a baby that was born full term.
Got it. That makes sense.
Yeah.
That makes sense.
So I know we're talking about, gestational age. Is there a difference between boys and girls when it comes to milestones and development if they're born, full term?
Yes. So I mean, it's a subtle difference, but yes. So how people say, oh, okay, boys develop like motor, like faster.
Yeah.
That's actually true. Like it's not like a very significant difference to like do different tables to evaluate. It's like we don't really in general pediatricians, we don't do different assessments between boys and girls.
Okay.
But it's just something to take in consideration. Like boys develop motor, especially gross motor, faster than girls. Girls usually develop the fine motor skills and the language skills before boys.
Can you differentiate between like what is gross motor and what's fine motor?
So gross motor is like the running, climbing, the walking, things like that. Fine motor is the pins, the grasp, the drawing, things like that. Like things that we associate. That's actually makes sense with what you associate with girls and boys, right? Like,
yeah.
I mean,
again, boys are wild, girls are more chill.
I mean, obviously that's so. But it comes from that. Like typically that's what happens, and again, it's not something that it is different, but it's not, I guess, statistically so different that they do
different screenings.
Exactly.
Got
so
it.
it's just, but you can see that, like, okay.
Right.
So don't get too concerned if a girl is taking a little longer to walk, like versus her brother or something like that.
Right. Absolutely. So when you're talking to parents about certain concerns, how does the conversation, I guess, how are you able to guide them with recognizing, okay, this is something that you really should be concerned about, as opposed to something that, okay, let's give it a few months. So like coming back you're at your 2 months and coming back at 4 months, and we're not too concerned about this fine motor not developing or this gross motor not developing at this point, and we come back and see it in like 6 to 9 months. Where should our parents really start to like have a concern, as opposed to saying, okay, we can be flexible with this?
So, obviously, it's important to take the parents' concerns seriously, right? I mean, they're the ones who are with the kid,
families,
the child. They're and they. Sometimes I know it's easy as pediatricians to say, okay, no, she doesn't know, like it's it's okay, whatever. But if a mom or a dad is worried about like something specifically, something probably is going on. Okay, maybe it's not as bad as they think.
Right.
But obviously we have to acknowledge and see, go into detail. Usually it's like, when a mom tells you, her kid has a fever, I mean, like, seriously, baby, he has a fever. Like, I mean, you can tell. I mean, it is something that, she just knows. So that's, first of all, very important, okay? But there are, obviously, that being said, a lot of times the concerns come from people telling her, like, he doesn't do this, or she hears like someone at school, she already, I don't know, like plays the piano, whatever.
Yeah.
So she's like, okay, well, my kid doesn't do that.
Right.
He doesn't even like, I don't know.
Right.
Like, so it's something. So it depends on the consent, right? Like, I mean, there are definitely red flags that will say, okay, if there is no. If a 2-year-old is it definitely doesn't have any like eye contact, right? Like if there is no speech development at that point, or there is no like if he's not pointing or things like that are so at certain ages, like definitely we have red flags, but so it depends on the specific concern, and if it is like, motor versus, because we are enough right now, people get too worried about speech because of the association with, autism.
Autism, right.
But, we see, I have seen kids that like are obviously motor delay and they don't care, I'm like, so why they focus so much on some areas
and not
versus
others.
no others, right? Like, I mean, you say, okay, he should be like, running, and you see them like, they're clumsy. So sometimes that can be actually be more significant than even the speech, right? Like,
Wow.
I mean, so it depends on the concern.
On the
okay?
concern.
But,
Yeah.
so definitely, so there are certain red flags. For instance, if you don't see a social smile by 3 months, that's a concern.
And that's called a social
Social
smile?
smile is like when they see your face and they smile, okay?
Okay.
So by 3 months, if that's not there, that then, you
Bring
you
it
have
to the
go
provider.
pediatrician, exactly.
Yes,
Don't like freak
absolutely.
out and, but bring her up, okay? If there is like no head control by 4 months, that's something
Okay.
also important. Okay, remember
Okay.
that it's something that develops. You see, like even newborns, they tend to like get some head control, but it fully should be definitely by 4 months.
By 4
for
months,
sure.
there
Exactly.
should be like.
When should for me, I like took my son home and like already practiced tummy time.
Right.
So like when should parents start that so that they can support that head control?
Well,
in
I
that
mean,
milestone?
but the head control is so you can do, I always tell the parents, because that's a very fair question. Like when they have still the umbilical stump, probably, it's not gonna be as comfortable, but it's not like you cannot do it. I mean, you can do it really at any age, as long as, obviously, you see the baby like going flat. I mean, please make sure you turn the baby's face to the side.
Right.
But because baby is gonna be moving, and but definitely never to sleep. I mean, if you're like sitting, watching the baby,
Right.
you can do it
Right.
at any point. But just like with never to sleep, and just making sure the baby, because some babies definitely don't like it, and then they go flat, and
And
you
that's
have to make
it,
sure
yeah.
baby's breathing.
Right. You made a good point. Tummy time. Didn't really think about making sure that stump, like when you're dealing with that umbilical stump, like it's
I
still
didn't even think
there,
about it.
and it could be uncomfortable for them to.
I mean, I
just be-
think so. I mean,
Yeah.
I guess no
You-
one
you-
has a baby, but
Right.
well, it makes sense, I guess.
right, because they're on their bellies and trying to maneuver. So that's a good point.
So
Yeah.
another red flag,
Yeah.
if they're not sitting by 9 months, okay? So usually
Okay.
they start sitting, by 6 months, or if they're not sitting by 9 months, that would be another red flag. If they're not babbling by 9 months, okay?
All right, babbling. So
Yeah.
are we're just like any type of like
Like
mimicking sounds?
yeah, exactly.
Okay.
Mhm.
Okay.
If they're not walking independently by 18 months, okay?
Oh.
That would be another red flag. No single words by 15 months, okay? Single words, okay? Or no
Okay.
2-word phrases by 2 years. Usually.
Two word phrases. So like my cup or
Exactly.
that type of thing.
That's all I hear from Liam. My chair, mine.
Right.
So usually to do that, they should have at least like 20 words. So
Got
usually
it.
at 2 years they have at least exactly.
20.
So that's what usually like in general red flags. Okay, obviously with any milestone you're gonna see. Okay, so if he didn't do it, like let's say it was at 9 months, then you can see variation. It's okay. And
Right.
also the path is important. Like let's say a baby, I don't know, didn't sit at 6 months, but they said at, I don't know, at 7.5. Okay, so I mean, obviously he's not gonna be crawling. It's gonna be a little. It's fine. I mean, it's a process, and you see the path. Okay,
Right.
don't think about just one specific thing. It's just how the path is going. It's fine.
Right. And then every child is different. So you may have like 3 or 4 children, and then watching them all develop differently. So like you said, like walking, if they're not walking by 18 months, we have some parents that have conversations and they're like, well, mine started at 9 months, mine started at 12 months, right? And then so just being able to be comfortable in that space of, all right, there's still some time here, but just being able to recognize, all right, where we are.
So, because also, being able to identify a delay on time is important to intervene, because the early intervention is also, it definitely improves outcomes. So you want to make sure that, you are obviously no freaking out, but if you see something, get the appropriate person to evaluate, okay, and
Right.
make sure, so in that way they can intervene if it is necessary.
If it's necessary. Oh, that's a good point. That's a good point, because early, so you being able to, or as pediatricians, they should be able to, if a mother or a father comes with a certain concern and that development hasn't occurred, and as a pediatrician, you guys recognize that, are you guiding them in the right direction to be able to get that support?
Correct.
Okay.
Yes.
All right. Perfect. Well, that is awesome. Thank you so much for sharing that, because that opened up my eyes to that. How are you guiding? Like, what activities are you giving parents to do to being able to get through those milestones?
So, also because there is a boom of things that people think they have to give to the kids so they develop better. So obviously, like in general, but they don't have to be complicated toys. Like the simpler probably the better. Depending on what you want to, obviously, books with figures, like colors, depending on the age, obviously they have to be age appropriate. Exactly. So those are important, but I mean, I know, the Mozart,
Montessori.
So usually simpler, like no electronics, definitely. At such a young age, definitely they don't need it. Like so many other things.
So you wouldn't recommend the electronics?
No, the American Academy of Pediatrics, no electronics,
So what age?
Yeah.
What age are we talking about?
We said no until 2.
Really?
Yeah.
Wow.
Oh,
wow. Yes. I know.
Listen.
I mean, that's a recommendation. Like, you can ask any pediatrician, probably, all of their kids have electronics before too.
Sometimes, for my mental sanity, I just have to put the TV on so I can cook dinner or do the dishes, especially if you have no village.
You don't have to feel guilty if you need to do it, right? It's just really to probably have just in mind that it's not like you're gonna leave him there and you're gonna pretend that he's gonna learn. Or he's gonna, no. I mean, and everything, in moderation is fine. Like, I mean, saying no, no,
Would you say, starting screen time at an early age, does that affect the baby's development or reaching milestones?
It depends on what you want when you put the baby to the screen, right? Like if you put it I don't know, teaching videos, thinking that he's gonna learn. I think the human interaction are more valuable and more important than just putting I don't know, teaching videos. Or,
I know, Miss Rachel's very common.
Right.
So obviously that's better than watching, I don't know, something violent. I don't know.
Right. Exactly.
Exactly.
Yeah.
So, if you're gonna cook dinner, but you put the that's fine.
No, that makes sense.
Yes, but the studies have shown that the more time, the screen time, they can affect development.
ADHD.
How much? It's hard to tell because it's not like we have studies kids that are completely exposed to but there is associations, and so what we know is that definitely affects so the less the better, and the later also the better, talking about phones and everything later on, but yes. So
it's so hard now because it's there's iPads, there's phones, and then there's other kids that are gonna have phones at an earlier age, and then your kid's gonna say, well, how come I don't have a phone? All the other kids in my class have one.
My 6-year-old asked me for an iPhone the other day. He was like, Mom, can I get an iPhone? And I'm like,
And the iPhone, not even
so not even a cell phone. It was very specific, and he was one of his friends had an iPhone, and he wanted to know when he can get his, and I said we can have a conversation
you were waiting
later.
For the 17, right?
Right, exactly, and that's a good point, because even with the human interaction, right, that 0 to 3, they're watching us, right? So what are we doing? We're on our phone, we're on our laptop, because 9 times out of 10, we're working parents, right? And we're constantly, if we're not trying to send an email or look at our phones for something, because a lot of people decompress by scrolling and doing things. And so what are your kids doing? They're watching you.
Exactly. Yeah. So very important, and not to forget that they're watching everything you do, and more
Absolutely.
than what you tell them is what they see, right? Like you can say one thing and then do another one.
That's right.
So,
That's right.
Definitely.
So, temper tantrums. How does that work when it comes to developmental? Is that a normal thing, or is that really something that parents could really work through? I always heard the whole terrible twos, right? I call them the terrific twos because our kids are terrific, right? Especially at that wonderful stage.
Yeah,
but is there developmental concerns with temper tantrums, or is that just a normal course in growth and development?
So yeah, I mean they're very common and they're normal to a point. Okay. It's really about power, okay, and when usually kids have a temper tantrum, it's because they want something, right, that they are not getting, right? So it's a vicious cycle. So if you give him whatever because he had a tantrum, then he's like, oh, this works, this is perfect. So next time, if he did the tantrum for a minute, next time he can, if you don't give it a minute, he's gonna be 2 minutes until you're gonna be like, okay. Yeah, 2 minutes. Next time it's gonna be 3, and it can last forever, okay? If you don't break the cycle, okay?
Wow.
Yes, so at some point, someone has to be the adult and break the cycle.
And break the cycle. Wow.
Exactly.
Wow. You said something about power. Wow. So it's like I feel like sometimes we forget that they are little human beings and they have minds of their own.
Oh no, and not only that. I mean, if you see, usually at that age, like 2, 3. They everything is about power. Like, I mean, that's when they start being picky about, for instance, the food, right? Like, you can like put the food in the mouth and chew for them, right?
Right.
I mean, they're like, and then you're like, I mean, so everything is about power. Like, they have the power of saying, no, I don't want this, and then you can't force them, right? Like, so if that becomes a fight, then that's when also this food, meal problems begin, right? Like,
Gotcha.
Usually ignore is the best thing to do at that age. Like, if you ignore, he's not want to, you don't want to eat, okay, go to bed. If he's not gonna die, a couple of times that he doesn't need, you're gonna force him, because then he's gonna get hungry at some point. You would leave, something that you want him to eat, like, by his
eye level.
And then it's gonna happen at some point, right? That being said, obviously we all do like, imagine he's panicked, like they're gonna be like, he's gonna die.
Yes.
Whatever.
Yes.
But in reality, that's if you see that everything is about power. With the temper tantrums, it's the same thing. So they know they're gonna get it. So this is super powerful for them.
Right.
And again, like I said, to a point. Obviously, kids with developmental delays, because they don't communicate easy, they have more temper tantrums. So that's probably a little deviation of normal, because sometimes it's just about communication. They can't tell you what they want. They can't.
Which it can also occur before 2 years old too, though, because they're still learning to talk and express themselves.
Exactly.
So they're unable to communicate their feelings or their frustration, so they're having a temper tantrum, which is what I went through. It was really hard, but now that Liam's able to like tell us what he wants, it's become a little bit easier. Not saying that there's no temper,
right?
Because it's every day. We're still working through it.
It's a progress,
Yeah.
It's you're learning him. He's learning you and learning how like the household is functioning, and just being able to recognize that. So that's
And
that's
these
huge.
2-year-olds, they're manipulating.
They always testing you, like in everything. They're like also testing their boundaries until see where you are, where you break,
And as parents, we have to be able to stay on top of our game enough. I like what you said. Sometimes you have to ignore it. You have to ignore it, so you recognize you're saying like, hey, no, I said this, and then they may show out, and it's as long as you're not giving them an audience, then they recognize like, okay, well, this is not
Sometimes
working.
they're just doing it for attention.
Yeah, but exactly. So, but if you give them the attention, then that means it's working, and they're gonna do it again. So that's most of the times it's actually about attention. So you have to like ignore, like,
Right.
you know, and don't get into big conversations. Like, I mean, you can't really tell, oh, don't do this because you know the world is like in, you know, no, just tell him, no, don't do that. That's it. Don't go into details.
Okay.
You know, because you know, he's gonna be like, what is?
So that they're not understanding when we explain to them this behavior is not becoming, and
and that's not the moment. Usually, you can tell him later, okay? And say to him, okay, after you know the tantrum is over, because he's not even listening. Okay, you can be like, when I didn't like that you did this because you know something short, you know, very concise. You know, don't go into details. Like if he bites somebody, you're gonna be like, oh, he's gonna get infections, antibiotics. No, nothing like that. No,
Right.
You don't do that because you don't like it if someone bites you. Okay, don't do it. Okay,
Gotcha.
Yeah, I would put Liam in timeout, let him you know, regulate his emotions, and then have that conversation with him. Not that he understands every single thing I'm saying, but he understands it to an extent.
Right. And then being able to explain their emotions too, because that's the feeling, or that's the thinking part of development, is them understanding their emotions, right?
Exactly.
When they know, well, am I happy at this point? I'm sad at this point. I'm mad at this point, and being able to give them those words and understand that.
And also, you know, depending on the, you know, you have kids that are very mature, I guess. They can tell you, oh no, I did this because okay. So obviously, they also have to have the opportunity to tell you if they have something to tell, okay? But at the end, you have to be like, no, you don't do that. Period. If you do it again, you know, it's gonna happen again. No, I'm not gonna get, you know, break. Okay?
Gotcha.
You are. I don't know.
Right. Absolutely. So, is there anything that you would like to share with our viewers when it comes to maneuvering through these milestones, and just one little tip that you want to leave for them?
So, I think probably the most important thing is that first of all, you know, you need to know your own child, okay? It takes time, okay? And know every child is, you know, same to her, okay? Even among siblings. Okay. So don't compare. I know it's hard, but at the same time, you know, make sure that, you know, you are giving that specific child their opportunity to develop, you know, in a different ways. Everybody has their strengths and their weaknesses, and always have a pediatrician that you trust. Okay, don't go to Google. Don't, you know, pediatrician.
ChatGPT.
Right.
Yeah. So pediatricians are, you know, I always tell, you know, patients when they ask me in the hospital, oh, you know, what pediatrician do you recommend? I'm like, you know, some pediatrician are like something that you're gonna see for so long, okay? You really need to love your pediatrician. Yeah. If you have someone that you don't like, you know, you have to change for sure, because it is something that you need to like trust and really be able to tell them, and that don't, you know, wash you all.
Not only that, as you said earlier, take their concerns seriously.
Yeah,
there's not a lot of pediatricians like you that actually would say something like that.
Yeah.
So.
Yeah, no, exactly. So it's important. I mean, obviously, you know, nowadays I know, you know, coming from the other side, obviously we are busy. We have to see a lot of patients to survive. Pediatricians don't make a lot of money. But, you know, you can tell, like, even, you know, who cares and, you know, who doesn't. So, and again, you know, it's about relations. So, obviously, I can have a pediatrician I don't like, but if somebody else likes it, you know, perfect. But, you know, it's just have your own pediatrician. That's important. Don't go to a place where it's like, today's one, tomorrow, no one knows who
they
your
are.
child is. Because then, that's when things get lost, you know. Then if someone doesn't, like, see your child, things are gonna get lost. No one is gonna notice if something is off or whatever.
Right. Oh, that's huge. That's huge. So, all right, guys, make sure you have your pediatricians that you can trust. Alrighty, and get to know your children really, because you are their biggest advocate. All right. So once again, thank you, Dr. Hurtado.
Thank you.
We appreciate you. Yes. All right. Until our next episode. Bye.